Good morning, everyone. This is Mike with Health Agents Network in collaboration with bankers Fidelity. I want to thank everyone for being on today. Again, we're going to talk about cross-selling life insurance and really incorporating life insurance in your practice. I realize with AEP coming up, being it's the end of August, that you can't cross-sell at the same time as a Medicare Advantage or Med Sup, or Part D plan, but you can with a Medicare supplement if Part D is not involved, or it's a great follow-up piece for post-AEP appointments. Because don't forget, when you're sitting there in front of your clients and prospects, set that next appointment, and this is a great way to talk to your clients about life insurance in that follow-up appointment. So we'll talk more about that. But again, if you have any questions, comments, concerns, threats, or promises, throw them in the question area of the user panel, and we'll address them as we go along. Otherwise, we'll have live Q&A at the end. So let's talk about life insurance. And I realize a lot of agents, and I've been told that, you know what, life insurance or final expense particularly isn't really sold a whole lot anymore. People aren't buying it. I don't see the need in selling it. So we're going to address that now. So looking at life insurance, take a look here. 78% of life insurance shoppers having a previous relationship with their agent bought life insurance when their agent presented to them. This is from LIMRA. So when you're talking to your clients, they may have that need for life insurance and don't realize that you're the one that can provide it for them. The other side of it is, if I've had agents tell me, well, how do I know if my clients are in the life insurance market? Well, you simply have to ask, and we'll talk more about that. But know that if you start that conversation, there's a good chance they're going to pick it up with you and have the conversation about life insurance. And as you can see, LIMRA found that 78% of people will do that and purchase a policy. 60% of consumers don't recall being approached to buy life insurance in the past 2 years. This is another LIMRA study. So not only are people thinking about buying life insurance, no one's asking them. So they go on, I need to buy life insurance. Maybe they think about it, then the life happens, and they forget to further pursue it. So it's our job as insurance agents to offer both life and health policies to address that need with their clients to see if it's something they thought about and pursue that option with them. 75% of Americans nearing retirement in 2010, I realize it's a little older statistic, but it's the most common one, most up-to-date one I could find, have less than $30,000 in their retirement accounts. And this has to go for, medical expenses, taxes, everything else. Yeah, it's their retirement account, and they may have it even at the end, but still they're going to have final expenses. They're going to have an estate that, is going to have tax on it. They have lots of other things going on. That $30,000 has to go through probate. So it's not going to be available right away. So we have to consider that when we're talking to our clients. Now, are people really selling life insurance or final expense plans? Well, here's the numbers. 30 carriers reported more than 433 million in new policies in 2012. That's 700,000 policies with the average premium of $649. So yes, people are buying final expense insurance, obviously. Average premium, $649. So if you have a 100% contract, that's $649 in commission for first year that you could be earning by offering your clients final expense coverage. Plus 700,000 policies a year. That's roughly 1,900 policies a day that are being sold out there. So if they're not buying from you, where are they buying it from? They're buying from another agent. They're buying from a mail solicitation, from an advertisement. Well, you know what? Be that agent for them and help them pick the most appropriate plan. So one big thing is don't sell life insurance. Sell what life insurance can do. Ben Feldman was one of the top life insurance agents in the country when he was selling insurance, and he sold what life insurance can do. No one wants to buy life insurance because they want a fancy policy. They want life insurance to take care of their family. So let's talk about that. One of the biggest obstacles I see in the market is building that bridge between health and life insurance. As you can see with health insurance, we've got hospitalizations, doctor visits, specialist appointments, prescription drug programs, surgery. All these things are designed to help you get healthy, to help cure or maintain the disease. So when people are thinking health insurance, they may be thinking, how am I going to live longer? How am I going to prevent this disease from killing me? How am I going to take care of myself? When we think of life insurance, people think of funeral costs, paying off the mortgages, medical bills, legal fees, other debt. These are things that life insurance can cover, but they're very different from health insurance. A lot of people don't correlate health insurance and life insurance. So you could walk into someone's home and they're thinking life insurance 10 minutes prior, But now life insurance is taken off, putting on the back burner, and they're talking about their health coverage with you. And they don't think to cross that bridge from health to life. It's not a natural transition like auto and home insurance, because we've been drilled our whole lives to have auto and home insurance as a package. Well, it's our responsibility as health agents to package health and life insurance, even though a lot of consumers do not. So make sure you are approaching that with your clients. How to start selling final expense. Here's the biggest thing. Don't overcomplicate the sale. I use this in the field, and I can tell you, I have a backstory here, I'll tell you in a second, but what life insurance do you have in place? Simple as that. That simple saying crosses that bridge from health to life. Does it work every single time? Of course not. Nothing works 100% of the time except the IRS. So what life insurance do you have in place? Well, I don't have any life insurance in place. Okay, is this something you've been looking at? You can start that conversation. Don't ask, do you have life insurance? Because they could say no and put up that wall of resistance. You want to ask a nice open-ended question. Or another question is, who takes care of your life insurance? You know, what company, what person? It's kind of open-ended and kind of go several different ways. There was an agency that we were working with, and all of a sudden their final expense just went up. Started saying a ton of final expense. And the question became, what we asked was, what are you doing to really, catapult your final expense sales? And they said, we just added this question to our fact finding. That's it. That's all they did. So if you overcomplicate the sale, consumers aren't going to buy. If you also overcomplicate the sale for yourself, you're not going to do it. I mean, I know I'm guilty of that. If something looks too complex to me, I'm going to have a hard time explaining to my prospect. So just have a simple conversation. What life insurance do you have in place? It really is that simple. Now you want to continue the conversation because it's not just about paying for funeral costs. It's flights for out-of-town family, time off work for your family to come out and attend the funeral, final medical bills. There may be other bills beyond what their Medicare Supplement or Medicare Advantage plan have laid out. Taxes, a huge issue is taxes, miscellaneous debt, credit cards, mortgages, auto loans, personal loans. Any other expenses they have laying around will have to be satisfied. You don't want to add fiscal burden to your family's loss. So when you're going through the fact finding with your client, when you're talking about how long they lived in the area and do they have any children, and their children, I have one kid in San Francisco and I have one kid in New Jersey, one kid in Florida, but you're sitting there in the middle of the country like in Missouri where I'm located, and what happens when they pass away? That's 3 flights for maybe families that have to come in. So if that family has a family of 4 or 5, that could easily be a $2,000 flight round trip. So that's $2,000 plus hotel, plus meals, plus everything else. Don't add that fiscal burden to your family when you pass away. So don't just focus on how much a funeral is going to cost. There are all these other expenses that we don't consider, and a lot of people don't consider when they pass away. Time off work. Do they have vacation time? Do they have, when they get this income, if they have any sort of inheritance, they're going to pay taxes on that too. So there's all these other things that we have to consider when someone passes away, and a final expense policy can help that. Plus, don't forget, final expense insurance is life insurance and is passed to the beneficiary tax-free. Another key area is when someone's leaving group coverage. When most people come off of their group coverage and enter the Medicare market, they're leaving behind their entire benefit program. All their short-term care, maybe even their long-term care, their health insurance, life insurance, dental, vision, hearing, all that a lot of times is left behind. So you want to make sure that as they leave their life insurance as an income replacement, because they were working, they now have to replace that with life insurance for their final needs. So talk to your clients that are turning 65, 68, 70, coming off those group plans, and it's a different conversation. It's no longer, you're working now. If you pass away, how you replace that income? It's okay. Now you've worked, you've got this nest egg. How do you protect it from your final expenses? Well, we need to set up a fund or a plan, which is a final expense insurance. This plan will help you take care of those final wishes. Now, we have a new competition in the field, and that is prepaid plans. As you know, a lot of funeral homes offer prepaid services, And you're going to run into this a lot when you cross that bridge into life insurance. Well, I've been thinking about doing the prepaid thing because it locks my expenses in place. So let's look at the difference between final expense and prepaid and how to go about that. So final expense is paid directly to the loved ones. They could use with it as they wish. If there's any money left over, so if you have a $5,000 funeral and a $10,000 benefit, they have an extra $5,000 to pay for those flights, those hotels, those meals, take time off work, and these things that these prepaid services don't consider. It's tax-free. So it passes to them. If it's a $10,000 policy, they get $10,000. They don't get $7,000 or $6,000 because the rest goes to Uncle Sam. They get the entire amount. Again, any additional funds can be retained so that any extra money can be used for these miscellaneous expenses and can be used at any funeral home. So if that funeral home you decide you want to go to goes out of business or changes ownership, or you move, the client moves, and they now have to pick a new funeral home, maybe you don't know the area, maybe your children do, and they can help pick that funeral home. Prepaid is paid directly to the funeral home. So if there's any extra money, guess what? There is no any extra money because it's already a prepaid plan. So those flights, time off work, and all those miscellaneous expenses are not taken in consideration. And they're going to have to take that from their inheritance, and they have to wait to go through probate, and that can really cause a lot of fiscal burden for your family. It may not keep up with inflation. You know, some have inflation riders, but is that really going to keep up with it? And here's the biggest one I see, is it may not cover all expenses. You know, the person selling the prepaid service may be looking to really have an affordable monthly rate because a lot of them have a monthly rate. Well, guess what happens? Maybe they include the vault if they're being buried, and that's another $2,000 that has to come out of pocket. Maybe it wasn't paid up in full, and the family still has to come up with money out of pocket. Maybe, you know, they prepaid for all this over here, but we have these three miscellaneous items, and that's an extra $5,000. And at a time of grief, it's hard to make these financial decisions. So take that off the table for your family. Just give them a check and say, you know what, here are the funds that you need to plan my funeral. Here's what I want. Hopefully they have something laid out, and you have a way to pay for it. And it may not be transferable. If they do decide to move or change funeral homes, it may not travel with them. So be very aware that, yes, prepaid is a valid option. Is it a bad option? No. But in my opinion, final expense is a far better option versus prepaid. So someone asks, what do they have if they have prepaid? Prepaid is basically a policy that they buy from a funeral home, and they lay out their funeral to a degree, like I said, because it may not include everything. And then let's say that it comes out to $8,000. So they'll make a 5-year plan to come up to $8,000. So let's say it's $50 a month until it's paid in full. So they're going to go ahead and pay that. And if there's any money, let's say they die in 2 years and it's a 5-year layout, well, guess what? They still have 3 years to pay for, the family does. So if you're not sure, you know, don't be afraid to go to your local nursing home, funeral home, and talk to them about prepaid. Just pretend like you're a consumer and get some information and see how they lay it out and what the costs are. Also, if you come into a funeral home and you say you have $5,000, you have a little more leeway on pricing sometimes. You can negotiate. And I hate to say about negotiating funerals, but it is a possibility, especially if you tell your family, go in there and say you have $5,000, but we have a $10,000 benefit. Take the extra $5,000 and use it for those extra expenses. So that's how prepaid works. So what to do from here? Again, get licensed for final expense. If you have a Bankers Fidelity contract, which hopefully you do, if you don't, give them a call, and you are already approved or contracted for all their lines of coverage. So the final expense plan they have at Bankers Fidelity, you already have access to. Incorporate this simple question when meeting with your clients. What life insurance do you have in place? And if you get any pushback, and someone asked just not right now, what if they give pushback on the question? Well, I'm paraphrasing that. But you know what you could do? You know what? Health insurance and life insurance do work hand in hand. Health is for when you're here and life is for when you're not. So I want to make sure that both areas are covered. And I ask this with all my clients. So if you have life insurance in place, great. You know, you're covered, and we'll move on to the health side. But if you don't, it's something to keep in consideration or something you should look into. And keep it as simple as that. You don't have to be high pressure. So if they give resistance, just, you know what, back off. You don't want to push the issue because then you could lose the health sale as well. So just, hey, what life insurance do you have in place? And here's the thing. Let's say only 20% of people you talk to buy final expense coverage. That's 20% more than buying now if you don't ask. So for every 10 people you talk to, that's 2 final expense policies. If you have a 100% contract, that's $1,300 in commissions that you're leaving on the table every 10 appointments. And just start the conversation. It really is that simple. And someone asks, do you really sell 2 out of 10? Depends. But yeah, you could theoretically, you should shoot for 3 out of 10 appointments should be buying life insurance from you. That would be a goal. And then, you can mold your conversation as you move through it. But don't be afraid to ask. I'll tell you, one of the greatest pieces of advice I ever got about doing an appointment was a great sales presentation is a natural flowing conversation with a sale at the end. So just have a conversation with your clients. Don't try and force a product down their throat. Just have a conversation. What life insurance do you have in place? Oh, I don't have any life insurance. You know what? A lot of my clients don't have life insurance because they left it behind with their employers when they retired. And they think, you know what? I don't need any more because I'm not working, but we want to make sure your family doesn't have any financial hardship when you pass. You may have a nest egg built up, and that's great, but they're not going to see that until after it goes to probate and everything else, and they may have flights to get here and expenses and hotels and all these other expenditures to come to your funeral. So let's make sure they have an emergency fund to do that with the final expense policy. And know what they're going to say? Oh, yeah, let's look into that. A lot of people at least explore it with you. So make sure you have that conversation with your clients. Again, it's that simple. The easier you make your clients to say, yes, let's look at that. Yes, let's do business, the more they will say yes. There's a reason when you go to a fast food establishment, you say, I want a number 2, number 3, number 7. You no longer have to pick a sandwich, pick a side, and pick a drink. They package it for you to make it easy. So, more resources can be found on Bankers Online Training and on Health Agents Network. I want to thank you for coming on today. If there are any other questions, feel free to go ahead and post those or ask in the question area. Now, this is being recorded, and you can watch it on healthagentsnetwork.com. We'll be posted there later this afternoon if you want a refresher on this. But again, thank you for coming out today, taking some time. Go to Bankers, look at their final expense product, and again, add that simple sentence, what life insurance do you have in place, to your presentation, and start selling some more life insurance. So thank you very much. Go out there, have fun, make money, and give impeccable service.